Dr. Seelman, thank you so much for being here today.
Sure, I'm happy to be here.
I wanted to give you the opportunity to chat a little bit about the work that you're doing right now, which is pretty profound in terms of working with a group of folks who have usually least amount of people wanting to hear their voices. And so I'm really happy that you're going out there, making sure that they're being heard. Can you tell us a little bit how you're doing that, especially in this moment of pandemic?
hmm Well, last year when the pandemic was just really hitting the United States, I had been recently given the opportunity to have a fellowship that focused on public interest technology. And I was partnered with Dr. Beth Minette, who's a Regents professor at Georgia Tech. And she and I had been talking about ways we might collaborate on our research and our overlapping research areas. And she's a computer scientist and I'm a social work professor. So you might think there's not a lot of natural linkage, but she does a lot around health and technology. And we talked about how can we use her expertise around human-computer interactions to try to capture some stories from LGBTQ people during the pandemic. My research focuses on LGBTQ health and well-being, and also health disparities. And so I could bring in that lens to this collaboration. And we have been working over the past year and a half on this project. So it's called Project LGBTQ plus Rise Up, and it stands for Resilience in the Southeast During a Pandemic. And it's a mixed methods multimedia study. And we wanted to have a way for folks to share stories of what they're going through in the pandemic, but especially how they're coping and how they're surviving and thriving. And so we designed the study in a way that participants are asked each month to share their thoughts and their experiences on a variety of topics connected to resilience. And so we have 30 individuals who all are in the Southeast US, and they identify as somewhere in the LGBTQ plus acronym. And they've been sharing with us some amazing stories of hope and optimism and how they're dealing with health challenges during this time, how they're staying connected in unique ways to their friends and their families of choice. So it's been a really amazing opportunity and something I think for both Beth and myself and our research team, it's just been very fulfilling to be able to see this knowledge formation in this time and be able to share the stories in a public way. So we created the project with the intention that participants could choose whether to make their stories available to the public, either as text or in a video or audio format. And so we've been able to already start sharing some of those publicly so that the stories are getting out there pretty broadly.
That was going to be my next question, which was, what do you want to have come out of this data? I know you mentioned some storytelling. What is your broad goals in terms of when you release the data? What would you like to see happen? What would success look like if folks are taking in the data that you've collected? What would they do with that?
Well, I think there's a variety of different audiences that we would hope to reach with the information. Typically with research, you do want to make sure that it's out there, getting reviewed by peer experts and getting published in journal articles. But with this study, we also want to make sure it's out there to the general public. So it's important for us to have this be a site where people can visit and hear the stories of others and get inspired and find some relevance for their own lives, for ways that they can think about coping and staying connected to people and using technology in creative ways, even when we're all socially distanced. So I think getting it out to the general public in that way is helpful. We've talked about having partnerships with librarians to archive the data for the long term. So we've been talking with librarians at Georgia State, for example, about ways that we can have the data available for future research. So things we can't even anticipate, maybe 40 or 50 years from now, where someone would like to go and study LGBTQ people's stories from the pandemic, COVID-19. We also have some graduate students at Georgia Tech who are working on creating an interactive display with the stories, and we'd love to have some opportunities for them to have that. They're working on the project now, so we don't know what it'll look like in the end, but having a way for the stories to be experienced by people in public settings, and even have a way for people to interact and respond to them. So, maybe they're given the same question about connection to the natural world that our participants were given, of how they find rejuvenation being in nature, and they can respond to those questions themselves in some way. So we have a couple different dimensions of knowledge dissemination that we hope to see from the project.
That's exciting. I am excited to see where you all take it, especially when that story element piece comes in there. I've always loved data that's animated. I think that's always a really good way to engage folks. Has there been anything in the data that you've collected that you've been surprised by in terms of how people have evolved over the course of the pandemic, considering we, thought we were out of the woods, in summer, and we're back? Has there been anything that surprised you in terms of how people have tried to rebound or be resilient in this time?
I think there have been a lot of topics that they brought up that have been surprising to me, both personally and just based on my knowledge of the LGBTQ community and what we know of resilience in this population. I think one general pattern we saw with participants was that, this project's going on over the course of a year. We're just wrapping it up right now in late September, early October 2021. But when we were first launching, I think folks just found it to be such a release to share their experiences on different topics. And the fall of last year in the Southeast was one of the waves of a lot of cases of COVID. And so it was particularly stressful in that time. And we found that participation kind of ebbed and flowed a little bit with the study. And after vaccines were widely available to adults, we saw less engagement with some of the diary topics, like in June or July. We haven't yet looked at the August data, which is the last diary month. But it'd be interesting to see if folks kind of re-engage in a way, both because it's the wrap up of the project, but also COVID caseloads have risen again in the Southeast in recent months. In terms of what they're talking about in their diary entries and in their interviews, one of the things that surprised me was people really gave examples of how not just that they're staying connected in unique ways, which I think through my own experience, I've seen, like, we can't see everybody we would usually see in this time. And there's a lot of barriers to interacting in person. So people have been moving things to video chats and phone calls. But what we saw with the participants is they were also saying they're actually deepening their relationships. So really being strategic of, in this circumstance, I can be very purposeful of who I'm maintaining social connection to. And so I can really give time and attention to investing, in this relationship with my sister, or this relationship with someone who's been a mentor to me. So really targeted, like, social connection. I think people have really also spoken a lot about ways that they're drawing on their own hardiness. So we know from health research with the LGBTQ community that we experience a lot of discrimination, a lot of barriers to affirming care. We experience a variety of health disparities. And what folks are saying is they're finding ways to promote their own health, that they're, sorry, I'm losing my train of thought a little bit, that they're finding ways to stay connected, and
that hardiness piece,
the
I think, is,
hardiness,
yeah.
right? So they, even though they've experienced difficulties in the past and in the present, they've actually drawn on that as part of their resilience. So saying that, I've been through difficult times before, or I've faced these barriers as an LGBTQ person, or as an older adult, or because I grew up in poverty. And so my experience of being in the COVID-19 pandemic is in that frame. Like, I can get through this because I got through these other things.
Fascinating. I do think it's true that when the pandemic first began, I know a lot of us, sought out things that, immediately made us feel better, whether it be, food or social media, that was very affirming. But I think as it started to wear on, some of those things that had once given us a lot of comfort became daunting, or became, something we wanted to reevaluate. So I think, I know a lot of folks who then, have gotten back into physical health and making sure they're taking care of themselves mentally, especially. And so I think that this is really fascinating from a study in understanding how people navigate complex situations of national crisis, especially from an LGBTQ perspective. That hardiness of, if you will, using your terminology, of having went through trauma and dealing with that's given them a sense that they can handle something else, is interesting in terms of how people view themselves during this moment.
And, building on what you said of, we all turn to some forms of comfort when things felt very uncertain, at the very beginning of the pandemic, especially. We can see that, I think, in the stories that people are sharing of, I realized I've been drinking more than usual, and I've been working on what to do about that. Or I realized I was checking the news incessantly of what's the current caseloads of COVID. And then I realized that's actually not an emotionally healthy thing for me to do. And I distanced myself from it. So there definitely are some patterns of behavior change that we saw over the course of the year.
Will that be part of the study results, is to say, here were, 3 to 5 things that folks did to better themselves during this moment of uncertainty that we would recommend in other situations where there's a lot of stress or uncertainty? Is that kind of where you're going with some of this, is to use some of these examples as templates or as roadmaps for folks when they enter situations that are beyond their control?
It's hard to say specifically directions for some of our outcomes with papers, but right now we're thinking of an initial paper that is about broadly themes of resilience. And I do hope that what we're drawing from there are things that can inform people in the future, regardless of what specific challenge it is. So if it's people reevaluating their relationship with their job and what their work-life balance looks like, I think being able to share that as a theme, as a takeaway, is something that potentially can be helpful for people in the future and in other situations that might look a lot different than the pandemic.
Sure. And for the LGBTQ Institute, one of the things that we try to do is connect academics with activists and advocates. One of the things that we found is sometimes they don't always talk to one another as often as they should. Um, and it's mutually beneficial to make sure that we're using data to inform our conversations, especially if we're trying to pass legislation or try to get people on board with an agenda. How do you see this being used potentially by activists or community organizations who want to highlight some of the findings that you have discovered?
Yeah, I mean, that's an interesting question, and an important one for us to really be considering with our output. I would hope that, for one thing, there can be dialogue between this project and the variety of community partners that are out there in the Southeast, because our focus is on this region, and you know that things that we're seeing can help inform their work, their policy agendas. I think, you know, one of the things that was highlighted that we see among participants is they actually are very engaged during this time in political activism and social change. And so I think there's a lot of energy of creating a better world and thinking how we each can contribute to that. And I think so there's a lot of overlap between what folks are saying is helpful and what a lot of these organizations are doing out there on the ground level. Another topic that came up was the importance of mutual aid. So being able to share stories of how people are providing concrete help to one another, I think can benefit local nonprofits of here's what people were doing in this point in time that may have been very grassroots and not organized by any one group, but they were using Twitch, for example, to do fundraising for someone facing a difficult situation in their community. And are there ways that kind of knowledge could be used by local partners in the future?
I see a lot of applicability, especially in regards to the need to tell stories about what's happening to folks on the ground. I think there's a lot of intersections there. Is there anything that you would like to leave folks who are watching this with in terms of advocacy, academics, and the need to understand LGBTQ communities?
I think one of the important messages around research on health with the LGBTQ community is there's so much more that can still be done. As much as possible, I try to work with people who are at the grassroots level of knowing what's happening on the ground in the local community and what's really needed with research. Really listening to communities that are often invisible or isolated or don't have a seat at the table when it comes to research. So when we think of the LGBTQIA acronym, you know, people that are transgender, people who are intersex, people who are asexual or polyamorous are often not included or centered in a lot of the research that's out there. And so I think researchers, myself included, have a lot of responsibility on us to make sure that we're not just focusing on gay men and lesbians that are white and wealthy, that a lot of research has tended to focus on, but really reaching out to the branches of the community who may feel very uncertain and not trusting of researchers, to try to repair and restore those relationships. I think that's one takeaway I would have.
Dr. Zielman, thank you so much for your time today and for your insights. We look forward to hearing more about the survey, its results, and can't wait to help publish those and get those into the hands of folks who could use them. So thank you so much.
Thanks so much, Ryan. I was glad to be here.